8 million people die worldwide due to excessive use of tobacco, which raises the question, is it possible to strike a balance between the economic dividends of tobacco and the disease burden it causes? To provide some answers and, of course, perspectives, I'm privileged to be joined by senior lecturer at the School of Public Health at the University of Zambia, and this is no other than Dr. Cosmas Zyambo. Welcome to the People's Space, Doc. It's great to have you.
Thank you so much. I greet all the viewers as well.
All right. So, Doc, as we kickstart our conversation, let's just start from your journey and what exactly inspired you to pursue public health?
Okay, so let's move a little bit backwards so that I provide some perspective. So I'm a physician by background. So when I completed my medical school...
Physician, physics or...
medicine.
That may not...
So I'm a medical doctor by profession. So when I completed, I went and worked at Kitwe Central Hospital. And then it was during that time that I felt that, public health was actually getting into me. I got a scholarship to go and study public health in Norway. So I was in Norway for 2 years. I did quite a lot of research there. And from that point, I felt public health was actually my route to take. So when I came back from Norway, that's when I joined the University of Zambia. Currently, I'm actually a lecturer in the School of Public Health, like you've said, a senior lecturer, by the way. I was the past immediate head of department for community and family medicine. So that department is a department that actually teaches students in terms of the community work.
So apart from the great work that you do at the University of Zambia, obviously there are other things that you do outside the University of Zambia, which extend beyond the passion of teaching and research and all these things that you smart people do. Any other interests? What are your hobbies? Do you watch some football, play some football, golf?
Yeah, so before I get into that, so like I said, I teach, but also I do quite a lot of research. So my PhD was in tobacco use in HIV population. So that's a key population, by the way. But I also do work in general population and also adolescents. Right now, we're actually looking into the key population of the prisons. So a lot of work that we do in terms of research. So I have a lot of hobbies. I love watching movies, soccer. Not all that much. I'm a Man U fan, by the way. Manchester United. Though we haven't been doing well.
Manchester United fan.
Though we haven't been doing very well. Yeah. So, but also I'm a philanthropist. One of the ideology that I have is that you are actually elevated to come down. Okay, so when you go up, in whatever you are doing, you need to come down and help the community. So I'm quite engaged into community work.
I like that.
Yeah.
You're actually elevated to come down. Something to think about, eh? Okay. Now, Doc, you mentioned something very interesting, when you talked about your PhD, which was looking at usage of tobacco among key populations which have to do with HIV. Now, one of the things about HIV is that you're either affected or infected. This is something that we've grown up as one of the key messages, to drive the approach towards HIV. What, among your key findings, what would you, does smoking make the situation bad? Or is it advisable for people that are currently HIV and engage in a lot of smoking?
Okay. So most of the people that are HIV, they do smoke because it's a coping mechanism. So research actually has shown that the people who are actually infected with HIV, they smoke 2 to 3 times more than the general population. Okay. Currently, we did a study. We're actually submitting a paper at the moment. Although here in Zambia, our results actually did not show the difference between the general population and those that have HIV and AIDS. But probably that could be due to people not, because they're self-reporting, right? So they underreported. So we didn't find that differences. But generally, the people who are actually infected with HIV, they smoke 2 to 3 times higher. Okay, there are quite a lot of implications, because then smoking has also issues to do with adherence to the drugs. It has been shown that the people who actually smoke, they aren't adherent to ARVs, and you know that for you to actually live longer, what you need to be taking the ARVs constantly and religiously. But if there is an abruption of taking of the med, then that is a side effect to that. But also, we know that those who are who have got TB, and they are smoking, they don't respond well to medication. Okay, but also we do know that those who are actually smoking, they aren't they are not able to keep to the routine of appointments to see the doctor, because you have to see the doctor at a certain period of time. But of course that is compounded by the fact that smoking doesn't go alone. There are a lot of things that are correlated, right? Smoking, some they smoke, at the same time they drink alcohol, at the same time they're depressed. So it's more of a cocktail. Yeah, but smoking itself has actually quite a lot of harm to our body. Yeah, and because of that nicotine, which is there, because nicotine is what is actually addictive. People know that actually smoking is bad. But you see, because of that nicotine which is there, they are actually hooked up to that and they continue to smoke.
Okay. How easy is it to be able to break free from the grip of nicotine once hooked to it?
It's not an easy thing. So right now, there are actually quite a lot of studies that we're doing to try and help the people, especially in the HIV population, to see what would be the best way for us to be able to help the people, those who are actually already smoking, right? So we have a program called Quit for Life right now, where we are trying to help the people to stop smoking by using the texting, and also because now there's a lot of technology, right? So we want to see if we could use that technology to help the people quit smoking, especially those who are HIV, right? And why HIV is a special population is because of the ARVs right now, right? People are living much longer than they used to live back in the days. Okay, because as long as you're taking your med constantly. But if you are smoking, then it means that you are susceptible to what we call the non-communicable diseases, right? So diabetes, hypertension, cancers. Yeah. So most of the people, actually, the HIV population, they die not because of the HIV itself, because we've contained it, right? But they are dying because of the comorbidities, the ones that I've mentioned. Yeah. So we are now actually looking to trying to see what would be the best way for us to help the people to stop smoking, right? Apparently, we don't have policies in Zambia as yet. And we are hoping that this study, the NIH grant that we are running now, is running in Zambia and also in Uganda. So there are 2 sites in Uganda. We are collaborating with Makerere University and also the University of Zambia. We've got 2 sites, Mongu and also Chipata. But out of that, we want to see how we can move a needle in terms of policy. People who smoke right now, they don't have the quit line, right? And even if somebody wants to stop smoking and then they go for counseling, we don't have the protocol at the moment. What protocol do we use? So if you are a medical doctor, I'll see the way I can counsel you. You go somewhere else, they'll counsel him differently. But we want to come up with a proper policy that we can use not only for the people who are infected with HIV and AIDS, but the general population and the adolescents as well.
Okay.
Yeah.
So we will get to the issue of technology that you earlier alluded to in a moment. But just to be able to understand, Doc, what are some of the prevalence rates of smoking among men and women in Zambia? Just give us a picture.
So different data sets. When I say data sets, we can talk about the steps, because we normally have the surveys that go on in Zambia. So different data sets report different, but on average of them, we are about 11%. Okay, so using the STEPS data. So the STEPS data survey is the survey that is sponsored by WHO, but it's more targeted for people, the NCD, people with NCDs, cancers, hypertension, diabetes, and things like that. But we're able to measure the prevalences of smoking as well. So it's about 11%. Okay, more of those who are 30 to 44, those are young people, are the ones that are smoking. Okay, that's the general population now, right? And we see that the males smoke more than the females. Okay, but also we see that the rural regions, they smoke more than the urban areas. Okay. Now, when we talk about smoking, we need to be careful the way we define, because different definitions use different prevalences. Okay, so we can talk about tobacco use, or when you talk about tobacco use, you are talking about cigarettes, you are talking about shisha, you are talking about e-cigarettes, you are talking about sunko, and everything, right? And then we can also talk about cigarettes themselves, cigarette smoking. Okay, so those are different. They use different, but on average, right, we're about 11%
as a country.
As a country, more of the males smoke more than the males. However, we see that remember that because of our culture, right? Because of our culture, when we talk about cigarettes, right? Of course, males will smoke more than the females. Actually, in terms of cigarettes, the prevalence of the females smoking, they're very low, very, very low actually. But though they're increasing at the moment.
Where does weed fall in all this?
The what?
Weed.
No. So okay. So let me hit my point, then I'll come to the weed. So the female, the prevalence is very low, right? But it's increasing though.
Yeah.
Okay. But what we see is that when we talk about smokeless tobacco, so smokeless tobacco is the snuff. Okay. The other way when we talk about snuff in our time is the sunko, right? Sunko is popular, right? And it's actually becoming more popular. But we see that when we stratify between males and females, we see that the females actually, they are more of the sunko than the cigarettes. Okay? Now, it's because of the culture. There are very few women who actually, traditionally, will smoke a cigarette. Okay? But they would go for sunko. And they'll smoke sunko instead. So just to add a bit of sunko, because we're trying to do quite a lot of studies on the same, and our students, they're actually looking on the sunko, the myth of sunko. So sunko is believed that...
I think I'm looking forward to that.
Yeah. So sunko is believed that it warms the body of a woman, right, to prepare her sexually. Okay? So back in the days, only the older generation used to use sunko. But we see younger people right now using sunko. The data that we did actually for Global Youth Tobacco Survey that we just recently launched, we've got a number of adolescents actually using sunko as well, right? But not only that, people believe that sunko is an immune booster. So those who are actually HIV positive, they use sunko to boost the immunity. But those are myths, right? Those are some of the things that we get in the community. Why are you using sunko? Okay? And also, to be a little bit crude, is that it tightens the vagina, right? Yeah, it tightens the vagina. So that way, there's good stimulation of a man during intercourse. So sunko actually is becoming more popular. If you go deep into the sunko, actually, it's also graded. Okay? It's graded, there's a whatever grade, high grade, the middle grade and things like that. But it's actually discovered that actually apart from the tobacco itself, which is crushed, they do actually add other substances in it. Unfortunately, one of our students actually did a study where they got the sunko and then they took them to the lab, whatever. There were actually drugs in that. So what made that sunko to be actually high grade? There were actually drugs in that sunko. So I think maybe that should be enough for the sunko.
No, but I mean it's quite interesting, Doc. And I say this because I was at some social gathering and a lot of women, I would notice that they were talking funny. And if I looked and when I paid attention, it's like there was something in their mouth. And when I asked, I was told, oh, that is Nsunko. So I'm like, okay, now you mentioned quite a lot of some of these myths. There could be some that maybe would want to know, is it true that Nsunko Doc does those things? Has it been scientifically proven that Nsunko, has those benefits that people believe?
No, so there are no studies actually that have gone into scientifically to be able to prove those. And that's why they are currently just myths, okay? But what's very important to bear in mind is that sunko is tobacco. Okay, whichever way we look at it, it's tobacco, and it's got quite a lot of side effects. Now, we didn't talk about the roots. Some of them, they actually sniff. Some of them they've put between the, in the gums. And some of them, they actually now, they insert the sunko vaginally. Okay, and as you know, that actually has got so much effect. When we talk about cervical cancer, right? Yeah, so it's actually we're trying to do some studies to look at how many of those who insert sunko vaginally actually have got cervical cancer. Okay, so whichever way we look at it, sunko is tobacco and should actually be discouraged at all cost.
All right, so you've heard for yourself. Nsunko is tobacco, irrespective of the myths that you believe in terms of benefits it can give you. And right now, we will take a break and we'll be back with more actually on the subject of tobacco and some of the societal norms. And of course, Dr. Zyambo will be able to give us some more perspectives on this important topic. See you shortly.
Tobacco achani tumika mwechumwera achani hapo. Yes, eno futi tulana nga pass the tobacco control bill. Achani? Pass the tobacco control bill. Yebo, yes.
Welcome back to the People's Space. Today we are talking all things tobacco, and my guest is none other than Dr. Cosmas Zyambo, all the way from the University of Zambia at the School of Public Health, where he is a senior lecturer. Doc, we obviously ended on a very interesting note, in our first segment. But before we do, Doc, I think there's an important detail that I forgot, to ask. As you were describing your journey, academic journey, and some of the philanthropic work that you do and these other stuff, there are those people that may want to ask, this is the people's space. People want to know things, Doc. That's about people. You know how people are, Doc. So some may want to know, maybe, what is the Doc's family life? Is he married? Things like that.
Yeah, so it's complicated.
Okay. Okay.
Yeah, okay, that's complicated.
Okay, there's complicated.
So
okay.
I've got two kids. One of them is actually doing grade 11 at the moment. And then that's a girl, and that's Luyando, by the way.
Okay.
So Mwinde is doing grade 9 at the moment. All of them, they are at the girls at the girls' school and the boys at the boys' school. I was at the boarding school, so I've always felt that, you tend to be much more independent when you go
to
to
boarding school.
the boarding school.
Okay.
Yeah.
Interesting, Doc. So let's just pick it up from where we left it, Doc. We were talking about obviously uses of tobacco, and right now, you had talked about the prevalence between men and women. Would now like to understand, what the just the comparison in terms of the prevalence of use when it comes to tobacco between men and women. And earlier on, you had mentioned that um, different categories of tobacco obviously is prevalent between men and female. But what I've noticed, Doc, this is just from a social observation. When you go to this social establishment, in the past, obviously, it was rare that you would see a woman smoke. But now, when you go in these social establishments, Doc, you will find that like that day, I would bet, Doc, I would put my salary on it that there were more women in that social establishment who were smoking than men.
Yeah. Okay. So the world is revolving. Okay. Like I said, traditionally and back in the days, there were a few women who actually smoked cigarettes. But because of the, a lot of products that are coming on, we see that females actually are actually also smoking. Apparently, the prevalence of the males is rising, but steadily. Okay, but we see that the prevalence of the females is actually rising much more faster than it's rising on the for the males. Okay, which shows that women now, they are getting into these tobacco use. Of course, there could be different gatherings. Let's say maybe in the urban areas where you see women who actually would be smoking, literally cigarette smoking. But if you had to compare that to the urban areas where it's culturally embedded, there are few women who would actually be smoking a cigarette, but they'll be smoking other cigarettes, of course. But suffice to say that women are now getting into this smoking, especially now that we're getting into the new emerging tobacco products, which is e-cigarettes and also shisha, which I'll probably touch on as well.
Okay. Doc, is it a fashion thing? Is it a peer pressure thing? Because sometimes I tend to wonder, and you mentioned, I like the point you mentioned that, the world is becoming a global village. There's exposure now. There's this, exchange of culture and all these factors that are influencing these behaviors. And as you weigh on that, the issue of weed, I noticed a lot of this, I'll say. I know a lot of men. I'm not speaking from a scientific evidence point of view, but I would suspect that there's still more men who smoke more weed than women. But right now, there's a whole lot of women that just smoke weed. And even you would see somebody on Facebook, on Twitter, everywhere posting like, today would be a good day just for some blunt.
Yeah. So when you are dealing with studies on tobacco, you definitely deal with the issues to do with alcohol. And you definitely have to deal with things to do with mental health. At the same time, you will deal with the issues to do with substance abuse, because this is more like a cocktail. Okay? They are co-related. Okay? So most of the people that smoke cigarettes or smoke tobacco, they would actually be smoking weed as well. They find it much easier to smoke weed. Okay? Those who actually smoke weed, definitely they do smoke tobacco. Okay, so they are more correlated. But in terms of the data sets that we have, and also in terms of getting into weed itself, we do not have quite a lot of data like we have on tobacco in general. Okay, and this is one of the things that we want to get into now, because weed normally comes in what we call the substance abuse. Okay, in the substance abuse. So there we get weed is there, and then we get things to do like cocaine, heroin, and things like that. And not only that, we have things to do with prescribed and non-prescribed medicines, right? You do know that kids nowadays, they use codeine. You know, they use codeine, you know, which is now more like a drug abuse. Okay. And also they use petrol, you know, they sniff the petrol. All those fall under the category of the substance abuse. Okay. Now, I would say that we need quite a lot of studies, both quantitative and also qualitative, to be able really to look at what are the prevalences of weed smoking, and also, let's say, maybe substance abuse in general in Zambia. DEC is interested in those studies. Actually, we do collaborate with drug enforcement, you know, in these studies, so that you know, we move policy, you know, and help the kids, not only those who are in schools, but those who are also out of the school. I think the issue of substance abuse is actually getting rampant. Just to digress a little bit, we did a study on illicit alcohol, you know, and, you know, the term that we use, junkie. I really don't like using the word junkie, because junkie comes from junk, right? So then you are calling a child a junkie, you know, and I think that's not a good terminology per se, you know, but it labels how far a child would have gone out of the way, and we need to salvage those children. Okay, and those, they all come under the auspice of the substance abuse, and most of them actually, they do smoke. So we're still in the same realm.
So, Doc, talking about the issue of studies, is there any that gives a picture, especially in adolescents, and perhaps highlights interventions that could be made to be able to address the situation?
So we did a study. So let me put it this way. We normally have surveys, okay? The Global Youth Tobacco Survey. This is now the fourth wave that Zambia has. So the Global Tobacco Survey are the surveys that are actually sponsored by WHO to be able to monitor the levels of smoking in adolescents who go to school. Okay? Now that's very important. There are adolescents who go to school between the ages of 13 and 15. Okay? Now, why that is important is because all the statistics I was giving you, the demographic health survey, you know, the state survey, you know, the ITC survey, all those, they actually capture from 18 and above. Okay? So the Global Youth Tobacco Survey is the only survey that actually monitors the level of smoking in the adolescents, those school-going adolescents. Okay? So the first one that we had was 2002, then we had one in 2007, and then we had the other one in 2011. Then there was a decade here until 2021. So we just actually launched in December. We launched the tobacco survey report. Okay, and we had staggering, you know, results. So we were able to note that actually the prevalence of tobacco use was 12.9, almost like 13%. Okay, and then of course the males are on the higher side. As usual, the males are on the other higher side than the females. 14% versus 11%. And then what was interesting is that those who ever smoked cigarette, okay, and those who ever smoked smokeless tobacco were 17% and 15%. Now, the ever is very important. Okay? The ever is very important because we are asking this child, have you ever smoked cigarettes? So we want to know whether they actually started smoking, right? Remember that the kids, right? The kids, it only takes one puff. Because of the peer pressure of the friends, you hang out together, and then one friend has got a cigarettes, then you smoke, and then okay, let me also try. So when did you ever, or have you ever? So that's very important. And 17% actually, and Sunko 15%. Okay, so those are staggering statistics, which we need to pay particular attention. Let me go further, and then because we want to know at what point did you initiate smoking, okay? And we found out that actually those who were actually almost below the age of 17, I want to get my statistics correct.
Very important.
Yeah. Those who were like 7 years and below. So 27.4% actually initiated smoking at the age below 7.
Look. You mean 7 years? 7 years?
Below 7, actually.
Below 7 years?
Yes. They initiated. So what that means, it means that young people, they're actually starting smoking at a far much tender age. Okay?
So could it be that they're seeing it from parents? And
yeah. So now, if they're starting younger, it means that even the interventions, we need to start much earlier. We catch them when they are young. Okay? But you need to know that the tobacco industry, they also market their products. Okay? They market their products. And these young people, they see what is being marketed. Okay? And we see a number of them starting to smoke. And those who are almost like 14 to 15 years, they initiated their smoking. We had about 31%. So 31% of these young people, they started smoking between the ages of 14 and 15. Okay, that's staggering, and I mean that's worrying. Okay, that's worrying, meaning that we need to be able to put policies in place. Now the question actually is, who sells those cigarettes? Who sells those cigarettes to the kids, and where do they find them? So we are talking about availability. Okay, we know that there are places where people sell cigarette tuntemba, which are close to the school, right? So we're talking about the availability.
Some of them are right outside schools.
Right there. And then we're talking about the affordability. In Zambia, there is no law that bars anyone from buying a stick. Most of the people you go, they'll sell a stick. Other countries have banned that actually. Yeah, I know we'll get into that, but those are some of the things that we are pushing for this tobacco bill, okay, to be passed into law. But then some of these things like a kid who you give money to buy sweets on the way, they go and buy a cigarette, okay? And then we're looking up in terms of the affordability, right? So it means that they're able to afford to buy, because then they are getting they're buying through just a stick. If you are to sell a pack, they wouldn't afford to buy a pack.
You've briefly highlighted some of the interventions, Doc. I would like you to build on that more by telling us some strategies that you think can be used to be able to prevent key populations in Zambia from starting the use of tobacco.
Okay, so before I get into that, I wanted also to mention that as we talk about the young people who are smoking currently, whatever they're smoking, it be cigarettes, and so on. There are new emerging tobacco products currently. It's so amazing that when you go to a bar, there's actually a shisha bar. Okay, and actually, shisha is more like it's like it's prestigious, right? It's prestigious. And then besides that, if you go to any mall, you get a place where actually people are selling the e-cigarettes.
Even the shisha itself, I've seen in some places.
So we are seeing a trend of more people, especially young people, getting to smoke the e-cigarettes and also the shisha, which actually also have similar effects in terms of the harms, okay, and also health outcomes. Actually, it's much more dangerous to smoke shisha than a person who's smoking cigarettes, because you're taking a puff. Now there's a myth that because there's water that passes, it's like that smoke passes through the water, so they are more like all the chemicals are going to be they're going to be filtered, then you're okay, but which is actually not true. The effects are all the same. So now
shisha is dangerous.
Shisha is actually dangerous, and we see a lot of young people who are actually getting to smoke shisha. So if you ask a question, and there's some of the things that we do as academicians, because we ask questions, we need answers, right? So if you ask a student or an adolescent, do you smoke? They'll tell you, I don't smoke, right? I don't smoke. Yeah. But if you ask further, are you currently using shisha? Right? They'll say, yeah, I do smoke. I do use shisha, right? They don't think that actually shisha is actually smoking, right? So shisha is part of the tobacco use as well. Now we're talking about young people, right? We're talking about young people. So there are a number of strategies that we can actually use to ensure that we protect these young people from smoking. The danger about smoking is that when you start it early, right, because your brain is still maturing, it's difficult really to quit smoking. And these are adults who are going to continue smoking throughout their lives. Why? Because they started smoking when their brains were not yet matured. Okay. Yeah.
So, Doc, just building on the important thing that you've mentioned, what then do you think? I mean, earlier on you highlighted that there's no policy or law that expressly, gives guidelines to the interventions to be able to achieve some of the outcomes that you would require to address the issue of excessive tobacco usage, which is dangerous to health. What is the role? What do you think government and strategic entities such as the NGO are supposed to be doing at the moment to be able to ensure that we achieve tobacco cessation?
So Zambia ratified what we call the, let me get the term correctly. So ratified what is called the Framework Convention on Tobacco Control, what we call the FCTC, right? That was in 2008. Okay, it was ratified. Okay, but then we have not actually. We haven't yet passed this into law. Okay, now there are a number of things that would actually benefit us if we were to pass that law, and these are some of the things that I want to highlight. Okay, so in that framework, okay, we have Article 20 that speaks on the monitoring tobacco use and prevention policies. Okay, so meaning that if this is passed into law, we are able to put in place the prevention measures. Okay, For instance, the kids who are actually buying the tobacco, right? Who sells those? Okay, I know we haven't passed the bill into law, but we did enact some statutory, okay, through the the local government, okay, banning of the minors from buying cigarettes, banning people from smoking in public places, okay.
Which still happens.
Those were put in place, but are these things still happening? They are actually still happening, right? So meaning that they are still weak. Those laws, they are still weak, okay? So the studies that we actually looked at the Global Youth Tobacco Survey, the results were actually staggering, which shows that actually we haven't done quite a lot in terms of those laws. So we need actually to reinforce these laws. Okay. Then we have Article 8, which protects people from tobacco smoke, right? So if I don't smoke, a person who is smoking must really go outside and smoke somewhere, right? Because secondhand smoking is also dangerous, and so you are talking about the kids who are actually starting to smoke because there's a parent who is smoking. So they see that as a normal thing, right? So just like the harms of smoking has got consequences in terms of the health outcomes. It's the same if you're staying with a person who actually smokes. It's the same if you are in a place where people smoke regularly. Because it's like you're also smoking. That's a second-hand smoking. And that's also a very, very big issue. Okay? Then Article 14, we need to offer help to those who want to quit. Okay? And this is very important. I think I've alluded to that.
Yeah, you spoke to that earlier.
So what do we do to people who are already quitting? Do we have policies that are put in place? Okay, currently we don't have those policies for the people who are actually smoking. Okay, other countries have done that. Okay, and by the way, we're talking about the tobacco control bill. Uganda just did passed law some 2 years ago, and I think we can emulate that as well. Article 11 and 12 talks about warn about the dangers of tobacco. Okay, warn in terms of the dangers of tobacco. That can also be done in terms of the school, right? So 2011 data, we did a study where we looked at how much of the learning do they do on tobacco, right? So we wanted to know what the students themselves, okay, how many times do you learn on tobacco? The numbers were actually pretty low as compared to other countries in the region. Okay, and that's why the thinking is that we need to interrogate the curriculum. Okay, so how much of the teaching in terms of tobacco harms is embedded in the curriculum? Okay, if it's there holistically, can we look at how is it being delivered? Okay, because now it's digital. Is it possible that then we could actually do some changes in the way we teach, maybe more of a debate, and maybe more of what we call school clubs, where people are talking about tobacco and also maybe substance abuse. Let me end with these two. So
yeah, otherwise my director will kill me.
To be able to reinforce, okay, the ban on tobacco adverts, promotion, and also sponsorship, but also to be able to raise the tax on tobacco. Currently, Zambia tax is at 40%, which is actually lower than what is recommended by WHO. WHO recommends 70% tax. What that does is that if you push the tax, okay, then we're going to reduce the prevalence of smoking, not only in the young people, but also in the general population as well.
All right, Doc. So as we get to wrap up, unfortunately, I know there's a whole lot to unpack and discuss when it comes to the issue of tobacco use. But I mean, we will create obviously another opportunity for you to come through and be able to give us more on this. What would be your last remarks on this important subject?
With everything that I've said, we would like to ask the government of the Republic of Zambia to pass the tobacco bill. Because when you pass the tobacco bill into law, we would be able to see the prevalences going down, and then in the long run, we'll be able to see the impact on the health of the citizens. So let's go ahead and be able to advocate for the bill to be passed. We know it has gone through stages. A lot of NGOs and other people actually are coming on board to advocate for the tobacco control bill. And I would like to take this as an opportunity, really, as an advocate for against tobacco, that let's go ahead and advocate for the government to be able to pass the tobacco bill. Yeah.
All right. Thank you very much for coming through, Doc. So that has been my guest on the People's Space. And of course, we've had an interesting and fruitful conversation with regards tobacco. And emanating from this conversation is the core, the clarion call to be able to enact relevant pieces of legislation that will ensure that tobacco is regulated, and also which will ultimately lead to the management and control of use. As we all know very well, that tobacco does pose a huge and significant toll on the health burden in this particular country. Money that could be used in other sectors of the economy is going to the health sector as a result of the high disease burden caused by excessive use of tobacco. And most importantly, Doc mentioned the issue of accessibility and affordability, areas that policymakers need to keenly look into if at all we are going to effectively control tobacco. And that is where the tobacco control bill comes in, as the doc did highlight in his concluding remarks. So thank you for joining me on the People's Space. The name is Winston Mavoro. Look out for another interesting episode as we do come to you every Thursday on our YouTube platform dubbed the People's Space, which also airs for those who are frequent Facebook, people, which is on the page that has the handle, the Center for Trade Policy and Development. So let's interact, let's comment. We'd like to hear from you, and also some of the guests that you would like to come and see on this particular platform as we discuss interesting topics within the Zambian economy and social governance. Till next time.